Menopause isn't a disease. It's a completely natural part of aging. It signifies the end of a woman's reproductive years. But this natural transition can feel incredibly overwhelming for many women as their bodies undergo significant changes. Beyond the commonly discussed hot flashes, women often face a range of challenging symptoms, including insomnia, making it difficult to get a restful night's sleep. Then there are the unpredictable mood swings, which can impact daily interactions and overall well-being. Many women also experience persistent anxiety and overwhelming fatigue that just doesn't seem to lift. These symptoms are very real, and they are primarily driven by fluctuating hormonal changes within the body. These hormonal shifts can disrupt nearly every aspect of a woman's life, from work and family to personal relationships. While hormone replacement therapy, or HRT, helps some women manage these symptoms effectively, it's simply not the right choice or even a safe option for everyone. Consequently, many women are actively seeking alternative solutions, including plant-based remedies and other holistic options. This search for alternatives has led to a growing interest in cannabis oil and its potential benefits. This is especially true for its non-intoxicating compounds like CBD, which offer therapeutic possibilities without the high. Women are increasingly seeking evidence-based answers about whether cannabis oil can effectively ease common menopause symptoms. They want to know if it can truly provide relief from issues like persistent insomnia and debilitating anxiety. The primary goal for most isn't to experience any psychoactive effects. It's to find genuine relief from their symptoms and restore a sense of balance and well-being in their lives. So let's delve deeper and explore what both scientific research and personal experiences reveal about cannabis oil as a potential option for managing menopause. When considering cannabis oil as a potential aid for managing menopause symptoms, it's crucial to know the difference between CBD and THC. These are the two primary compounds found in the cannabis plant, but they interact with your body in very different ways. THC, or tetrahydrocannabinol, is the psychoactive compound. It's the component that causes a high, that altered state of mind. And that's usually not what women want for daily symptom relief, especially when trying to maintain focus and clarity. CBD, or cannabidiol, on the other hand, is non-intoxicating. It doesn't produce that high feeling. Instead, CBD interacts with the body's endocannabinoid system, a complex network of receptors to help regulate mood, anxiety, and sleep patterns, and more. It can also play a role in managing pain and inflammation. Most menopause-focused products are high in CBD, offering a potentially natural way to address common symptoms. And they are very low in THC, ensuring minimal to no psychoactive effects. These products are often labeled as CBD oil or hemp extract, making it easier to identify them. Hemp-derived CBD contains less than 0.3% THC, which is the legal limit in many places. So it won't impair your mind or affect your ability to perform daily tasks. Understanding this distinction between CBD and THC helps you choose products that support your health goals, allowing you to make informed decisions about your well-being. It's about finding relief without the high and maintaining a sense of control. CBD's appeal lies in its potential to ease symptoms, offering a more natural approach to managing discomfort, while keeping you clear-headed and able to fully engage in your daily life. Always check product labels carefully. Pay close attention to the listed CBD and THC content to ensure it aligns with your preferences. Informed choices start with knowing what's in your bottle, empowering you to take charge of your health journey. Now, what does the research say about the potential benefits of CBD for women's health? Research into the potential benefits of CBD for managing menopause symptoms is still in its early stages, but the early findings we have are quite promising and certainly warrant further investigation. Scientists are actively exploring how CBD might offer relief during the significant life transition. Studies suggest that CBD may be beneficial in improving sleep quality, primarily by working to calm the nervous system, helping to quiet those racing thoughts that keep you awake at night. It also plays a role in reducing anxiety, a major contributing factor to insomnia and disrupted sleep patterns often experienced during menopause. CBD is known to interact with serotonin receptors in the brain, which may contribute to stabilizing mood fluctuations and easing feelings of anxiety and overwhelm. Furthermore, its anti-inflammatory and natural pain-relieving properties could potentially provide relief from joint aches, muscle soreness, and persistent headaches that are commonly reported during the menopausal transition. By directly addressing sleep disturbances, mood swings, and physical pain, CBD may offer a pathway to restoring a sense of overall well-being and improved quality of life. The endocannabinoid system's primary job is to maintain the body in a state of equilibrium and balance, and CBD may act as a supportive agent in this crucial regulatory process. While more rigorous menopause-specific clinical studies are definitely warranted and needed, many women have anecdotally reported experiencing meaningful relief from their symptoms through the use of CBD. It's important to remember that CBD isn't a cure-all solution, but it does present itself as a potentially valuable, science-backed option for managing some of the more challenging symptoms associated with menopause. Always prioritize looking for credible, peer-reviewed research and be sure to consult with your healthcare provider before incorporating it into your routine. Next, let's delve into the important aspects of how to use CBD products safely and effectively. Using cannabis oil safely starts with choosing the right method and dose. Sublingual drops, under the tongue, work quickly. Capsules offer precise, longer-lasting relief. Topical creams target localized pain without affecting the whole body. Start with a low dose, 5 to 10 milligrams of CBD once or twice daily, and increase slowly if needed. Track your symptoms and adjust only as necessary. Everyone's response is different, so patience is key. Quality matters. Choose reputable brands with third-party lab testing. Let's finish with a few final safety tips. Always talk to your doctor before starting CBD, especially if you take other medications or hormone therapy. CBD can interact with some drugs, so professional guidance is essential. Watch for side effects like fatigue or digestive changes, usually mild and dose-related. If you notice problems, stop and consult your healthcare provider. Only buy products with third-party lab reports to ensure purity and potency. CBD offers a promising, non-intoxicating option for menopause relief, but it's not a magic bullet. With a cautious, informed approach, you can explore whether it fits your needs. Menopause is a journey. CBD may help you navigate it with greater comfort and control.